Good afternoon and welcome to Live Healthy Miami Gardens Facebook Live weekly health and wellness series brought to you by the City of Miami Gardens, Live Healthy Miami Gardens. Our goal is to bring our community information and resources to help us make the healthiest choices possible for ourselves as a Miami Gardens community and our families. My name is KeTia Harris. I'm Community Health Data Specialist at JTCHS Community Health System, Program Manager for our Breastfeeding Touchpoint Program based out of JTCHS Miami Gardens, and member with Live Healthy Miami Gardens, as well as your host for today. Live Healthy Miami Gardens was born from the realization that although health is largely influenced by our individual choices, the conditions in the communities where we live, learn, work, worship, and play are also major contributing factors to the racial and ethnic health disparities and health care disparities faced, as well as our overall ability to make healthier choices. We know that these conditions are systemic, historical, and continue to impact us as community of colors and a whole here and now. Live Healthy Miami Gardens is a community initiative and part of the city's effort to address these conditions and reduce poor health outcomes through the transformation of policies, our environment, and the healthcare system overall, making the City of Miami Gardens a healthier place to be. This includes our Take Your Loved One to the Doctor campaign, and October is Take Your Loved One to the Doctor, an annual health and wellness campaign by Live Healthy Miami Gardens for our community. Joining us are Dr. Jody Grace, professor at St. Thomas University and host council member with Live Healthy Miami Gardens, who has been instrumental in the Take Your Loved One to the Doctor campaign since its inception, as well as Calliope Ortega, a recent graduate of St. Thomas University. She graduated with honors magna cum laude in May 2021 with a bachelor's degree in psychology and a minor in criminal justice. Calliope served on the executive board of the Psychology Club at St. Thomas University for 7 semesters. Through community-engaged classes, Calliope has worked in partnership with Live Healthy Miami Gardens as part of the 2019 and 2020 Take Your Loved One to the Doctor campaigns, where she recruited individuals to take the pledge and conducted follow-up surveys for the campaign. She also assisted with the CDC-funded COVID-19 vaccine hesitancy grant for Miami Gardens. Calliope is currently in the process of applying to graduate school in the field of psychology and law and plans to volunteer her time as part of the 2021 Take Your Loved One to the Doctor campaign. Jody and Calliope, welcome.
Thank you, KeTia. Thank you. Thanks for the introduction.
Hello. Thank you for joining us today. Thank you for all the work you're doing so far, especially with the Take Your Loved One to the Doctor campaign, not only this year, but for the past 3 or 4 years. And Jody, I know you're not a stranger to the live at all, but can you tell us a little bit more about yourself?
Sure, I can. It's interesting. You say I'm not a stranger. I still get a little bit nervous for these. So, hi, everyone. I'm an associate professor of psychology at St. Thomas University, and I've loved working with Live Healthy Miami Gardens on both the host council, and I serve as one of the co-chairs for the primary healthcare and mental health subcouncil of Live Healthy Miami Gardens. So, this is our 4th year, KeTia, for Take Your Loved One to the Doctor. And we want it to be a big year this year. Of course, it has started, it started as a national day. But here in Miami Gardens, we've turned it into a year-round movement, as you said, with a focus in October is our big campaign month where we ask people, of course, to take themselves and a loved one to the doctor for a wellness check or a yearly visit. So that's a lot of what I'm spending my time doing right now as we are in October. So I'm excited to be able to talk about the campaign today. So thanks for having me.
Thank you again for joining us. And can you tell us a little bit more about what is the need for this campaign? Why is Take Your Loved One to the Doctor or just taking your loved one to the doctor important?
Great. So we know that by getting to the doctor for those yearly wellness checks, that's when we can detect and screen for some of those diseases. Some can be kind of quiet, right? We might not realize that we have diabetes. We might not realize that this is the age when we need to be having a screening, for example, for breast cancer or something like that. So this is a chance by doing that check-in, that yearly check-in, we can make sure that we are as healthy as we can possibly be. Now, when we first started this campaign, and again, it wasn't our idea, we built on an already existing idea, but when we decided to bring it to Miami Gardens, what we realized in some of the survey work that St. Thomas did is we realized that we had a really health conscious community in Miami Gardens. So people are going to the doctor regularly, they're going to their eye doctor, they're seeing their dentist. But we all know somebody in our life, right, who is not very good about going to the doctor regularly for a variety of reasons. And in this original work that we were doing, we wanted to find those people. But the truth is, I didn't know how to find those people, because who knows, those people who may be a little bit reluctant? Well, we all do, because they're our family and our friends. They're our loved ones. So what we want to do in this campaign is make sure that we think about our own health. That's why we say take yourself. That's the first part of the pledge that we're going to ask you to do, is to take yourself to the doctor, because sometimes we put that off, right? We do other things, or we even put other people first. We need to make sure that we take ourselves to the doctor to make sure that we're as healthy as we can be. And then in your head, think of that person who you know could really benefit from getting to the doctor, or they haven't been in a while. Think of that person, a work colleague, a friend, a family member. And then what we're asking you to do is to do your best to try to get them to the doctor. We're giving you 90 days, right? Try to make that appointment in October to take yourself and then support a loved one in getting to the doctor. And that's the pledge we're going to be talking about, KeTia. So I think that, number one, it's so important to screen and detect things that might be going on, or just to get a check mark saying we're good to go. And secondly, to reach out to our community and our loved ones to encourage and support them to also get to the doctor.
Thank you for that, Jody. And you've been, just to reiterate, you've been part of this, involved in the campaign since its inception, since the beginning, correct?
Yes.
Awesome. Kalaya P, how did you get involved with Take Your Loved One to the Doctor?
Well, I started off by taking a health psychology class with Dr. Grace, and we were asked to be a part of Take Your Loved One to the Doctor, and I had to volunteer for certain days that I could go, and there were some days where I was able to go and actually go out into the community pre-COVID, and I was able to actually speak to people personally, ask them to take the pledge, see people tell me about how the pledge has helped them take a loved one to the doctor, or find out certain health, not complications, but certain health things that they may have not known before. And yeah, that's how I got involved originally. And then I've just been able to help out Dr. Grace and the Take Your Loved One to the Doctor campaign ever since, every October since. It's going to be now my third October on this campaign. And I've been able to do follow-ups too in the 90 days afterwards. And I've been able to hear some testimonials from people, some real life experiences because of Take Your Loved One to the Doctor. So it's been a privilege.
Thank you. And it's a privilege to have you a part of this campaign, even beyond graduation, and that you're still involved in this campaign. And whether your involvement, whether this is dealing with your involvement or with the campaign itself, how has Take Your Loved One to the Doctor affected you personally?
Well, I've actually had to do the pledge personally. I didn't have to, but I volunteered to do the pledge myself because I think I'm not the only college student, but I think as a college student, I haven't put my health first. You know, you don't have your parents. You may not have your parents. They're taking you to the appointments anymore, or now you have to get a whole nother primary care physician. And I had my pediatrician my whole life. So I actually still have not done that, but gotten my own primary care physician. That's going to be my goal for this Take Your Loved One to the Doctor campaign. So, and also to go to the dentist. So it's a transition in college. You might get a new insurance, or you might still be on your parents, but you need to go through your insurance to get a new doctor and all that. And it's actually intimidating, I think. So I think Take Your Loved One to the Doctor is able to push me to go to my checkups each year to do those things and actually take care of my health, because I think we get carried away with life and how busy we get that we forget to put our health first. And Take Your Loved One to the Doctor has been a constant reminder every year that for me to actually go do those things.
Yeah. So when I first became involved with Live Healthy Miami Gardens, one thing I did appreciate was the idea of taking control of your health. Throughout all the initiatives, that was a big thing of taking control of your health. And that's one thing that I've heard constantly with Take Your Loved One to the Doctor. So I'm glad to hear that empowerment piece when it comes to the campaign is also reached in the college community. I don't think that's something that I would have otherwise thought about, but I do appreciate you sharing that, how it has impacted you personally as a college student. And Jody or Calliope or Jody, either of you can answer this if you want to. Just to reiterate, this is not only for one day, but this is a multi-day event.
Yeah, so we think of it as a movement, right? A year-round movement that we should be thinking about our health, but that's hard to always do year-round, 365 days, right? So we do have the focus in October for being the time to really galvanize and try to get yourself an appointment and support a loved one to get that appointment as well, and to help people out because we know it's difficult. Some people maybe don't have insurance at all. Maybe some people have insurance, but we call it being underinsured, where the copays are still prohibitive, right? It's expensive. For example, Calliope mentioned dental care, that she made a dentist appointment, which is great because we know that the highest levels of medical avoidance or medical delay tend to focus around dental care. So as part of this campaign, there are 4 free, let me reiterate that, medical screening days that are happening this month. And I really want to highlight those because for people who maybe you haven't been to the doctor in a while, and there's a variety of reasons for that, but sometimes it's about lack of insurance. Sometimes it's about being underinsured, or you just didn't get around to making that appointment. Well, these 4 days are going to offer so many great opportunities to get screened. So for example, I just mentioned dental care. Both Center for Family and Child Enrichment and Jesse Trice, KeTia knows this, Jesse Trice Community Health System, are offering oral health screenings. This is free. And they're doing oral cancer screenings where they check for oral cancer. They're doing a teeth cleaning and a fluoride rinse. I mean, that's a great opportunity if you haven't had dental care. And sometimes we see, I study reasons why people may not go to the doctor in a timely fashion. Sometimes, believe it or not, when people go to the dentist, they feel bad that they haven't been to the dentist, which it doesn't matter. You haven't been, who cares? But we worry, like, oh, I haven't been to the dentist in a long time. Well, here's a great opportunity. So the days are Tuesday, October 19th at Center for Family and Child Enrichment, and Friday, October 22nd at Jesse Trice. And those oral health screenings are happening at both of those. But KeTia, that's not it. I sound like one of those people, I'm like a commercial. That's not all. Both at CFCE, Center for Family and Child Enrichment, on Tuesday, October 19th, and also at Jesse Trice Community Health System on Friday, October 22nd. There are going to be mental health screenings both of those days. As a psychologist, it's important that we do take care of our health, not just physically, but also our mental health, which also includes our social relationships. After such a tough time these past couple of years, I think it's a great idea for everybody to just do a check-in on their mental health. I want to highlight also what's being offered at CFCE. That's the Tuesday, October 19th screening day. And they have extended hours till 7 p.m. So even if you work that day, you could get there after work. But for women, it's no one's favorite exam, let's be honest, the pelvic exam, the pap smear, but we need to do it. It's the way we screen for cervical cancer, which is one of those cancers that really affects all ages. And so CFCE on that Tuesday, October 19th is offering free pelvic exams for women between the ages of 21 and 65 years of age. If you're between 21 and 65 and you have not had that pap smear in a while, again, we understand it's not the favorite, but just get yourself there. There's also going to be COVID tests and COVID vaccines at 3 of our screening days, flu shots at 3 of our screening days. I haven't mentioned that on Saturday, October 23rd at UHI Community Care Clinic, you can get a flu shot there. CFCE as well, and Jesse tries. You can get a flu shot, but you also kind of get paid if you get a flu shot there. Because KeTia, you get a $10 Amazon gift card if you get a flu shot on Saturday, October 23rd at UHI. I have a conference that day, so I can't go that day. If I could, they told me I could go get my flu shot there and get that $10 Amazon gift card. So, that's just something like take your family and get those flu shots. Right. Doctors recommend October for the month to get your flu shot, right? That's a great, you can do it afterwards, but October is a great month recommended to get your flu shot. There's so many screenings. So, and then the last day of screenings is on Saturday, October 30th. At Universal Medical Clinic at UMC. So, I just want the community to know that there's some really good opportunities, and say thank you at the same time to Center for Family and Child Enrichment, Jesse Trice Community Health System, KeTia, thank you. I know you've been so involved with Jesse Trice and Live Healthy and Take Your Loved One to the Doctor. And thank you to UMC and UHI, 4 of our community healthcare providers who are stepping up and offering free screening days. So I just want to make sure that we get that information out, and I'm happy to repeat anything or answer questions. Let me also point out it's Breast Cancer Awareness Month, right, here in October. And Jesse Trice is actually offering mammograms for women. Now, this one is for uninsured women, correct? So women between the ages of 40 to 49 can get a mammogram that day on Friday, October 22nd. And if you're 50 to 64 and an uninsured woman, you can get a referral for a free mammogram. So these are some great opportunities. So thank you, again to Jesse Trice. And I partnered with KeTia on this work last year. So she knows all about the great screening days that are offered.
Yeah. So 2 questions. One, how can the community register for a screening day or the screening days? And 2, how can the community get involved with Take Your Loved One to the Doctor campaign itself?
Perfect questions. Thank you, KeTia. Great segue. So to sign up for those screening days, they recommend that you get an appointment. And I think that's better for the patient and the provider because you can manage the time a little bit better. So to do that, just go to livehealthymiamigardens.com. It's scrolling on the bottom of the screen. So all one word, Live Healthy. So it's www.livehealthymiamigardens.com. Go there, and there you can sign up for an appointment. Now, you're not actually signing up for an appointment. It's going to show you the different days and the screenings offered. You would select one of those days. And it'll look a little odd because it'll say 10 a.m. That's just the start time, right? You're not signing up for 10 a.m. You click on that, and then someone's going to reach out to you. Her name is Daphne Joseph, and she's great. She's going to reach out to you to talk to you about what's a good time for you to come that day. So again, livehealthymiamigardens.com. Click on setting an appointment. Pick the day you're interested in, and then someone will call you. Daphne will call you within 48 hours. To help book that appointment. And then you can also walk in. So, let's say just for some reason you couldn't get that appointment set, you can walk in. They prefer if you make an appointment, but if you didn't do that, you can still walk in on that day.
Thank you. And thank you to Alejandra Sarias for her comments. She shared that this is going to be a great opportunity for those who have not had a medical visit or who aren't insured. Agreed.
Yeah, that's so true. And, another way, KeTia, that people can get involved is starting off by taking the pledge, and making that commitment to take yourself and a loved one to the doctor. So how do you take the pledge? Well, this is also going to see something you'll see probably on the screen, but you text the word doctor, and you have to spell it out, DOCTOR. Text the word doctor to 797979, right? So you just get your phone if you have it handy, and you text the word doctor in the message, and the phone number you're sending it to is 797979. You're going to get a message back with a link in it. Click on that link. You're going to answer a few questions about whether you have insurance or a medical home. Those questions are just so that we can help guide people to the screening days if they need them. We'll also ask for contact information. The only reason for that is to follow up. So we'd love to get so many pledges coming in from this Facebook Live today. So if you're watching, text the word doctor to 797979 and let's get those pledges up. I'd love to see the number increase after this Facebook Live, KeTia.
Right, likewise. And before we wrap up, thank you again, Calliope and Jody, for joining us today. Before we wrap up, can you tell us a little bit about the upcoming Empowerment Summit?
Sure, that's on Thursday, October 14th. And the location is Zoom. So, you've had a long day and you're like, oh, can I go somewhere else? Don't worry. You hop on Zoom. It's from 6 p.m. to 8:30 p.m. And we're going to be listening to great speakers. We're going to have some exciting conversations in breakout rooms where we talk about things like how to speak to your doctor, right? How to communicate what you want to communicate to your doctor. We're also going to encourage vaccinations and try to encourage young adults to get vaccinated for COVID, because we know that that's our lowest vaccination rates is among our 16 to 24-year-olds and 25 to 34-year-olds. So if you think about this campaign this year, KeTia, we really have 3 goals. The goal of taking yourself and your loved one to the doctor, the goal of taking yourself and your loved one to get a flu shot, right, as we go into flu season, and to take yourself, if you haven't already, and a loved one to get the COVID-19 vaccine. Or if you are one of the people who qualify for the booster, to sign up for that booster. So think of it as a trifold goal this year.
I appreciate it. And are there any final thoughts you would like to share with those who are viewing now or might access the live a little bit later?
Well, I'm going to turn it over to Calliope because I talk a lot. And so let's let people hear from Calliope.
Well, I thought something good to share was I actually did go to a screening day last year for last Take Your Loved One to the Doctor campaign. And I went with a loved one, a friend, and we actually pushed each other to make an appointment. So we went and I know Dr. Grace mentioned the mental health screenings. I thought that went well. I thought it was needed, especially after quarantine and we're still in the pandemic, and it did seem to have a lot of mental health effects on people. So I thought that was very helpful. I thought that I did the dental health screening, and I hadn't gone to the dentist in years before that because I had a children's dentist before too. So I never had an adult dentist. So I went to that for the first time in a long time, and I was nervous because I was like, they're going to tell me I didn't brush my teeth enough or something. But they were actually amazing. They were so kind, and they gave me, the tips that they give everybody, like you better floss more. And they were very kind. And I actually now, that's why I wasn't as scared to make a new dentist appointment this year. And I got my flu shot last year too. I did all the benefits. I got them all, and it was easy to do. It didn't take long. I felt like it was very a personal experience. They took care of me, and I felt that it was just an amazing experience. I think that when you hear free, you get a little bit intimidated, like maybe there's going to be a lot of people and stuff like that. Mm-hmm. But because they do make those appointments and those slots, I think it feels very personalized. It feels like almost as if it was your own personal doctor or primary care physician. And I thought that was an amazing experience, actually. And it made me not so scared this year to take the pledge and to do it all over again. So I just wanted to share that personal experience with the screening days.
Beautiful. And thank you again for sharing your personal experience. Thank you for your involvement, Calliope and Jody. And those who are viewing, thank you for tuning in. Those who might view later, thank you for viewing. And we hope that you do take the pledge, receive the services that we're providing through our various FQHCs and other health centers, and take yourself and a loved one to the doctor and take control of your health. Eric, thank you for your thoughts. Thank you for everything you do for the community. That was, again, a comment by Eric. And continue to live healthy until next week.
Thank you, KeTia.
Bye. Thank you.
Thank you. Bye.